also members of the British Bulgarian Business Association, as we have offices in both countries. So I'm really pleased that we have this event organized through both chambers, showing that the British Chamber network through the British Chambers of Commerce is able to stretch beyond the individual countries we're in. And I can see we have participants here based in the UK as well. Good afternoon, Raymond. And again, this is one of the virtues of this particular situation of using the medium of Zoom for webinars such as this. Now, we are also live on Facebook, and this is being recorded. Now, if I can send you, please, for those of you who are on Zoom, here is the link to the page of the BRCC's website with a brief description about today's call and who our speakers are. If I can introduce them very briefly, Charlie Crocker, known to many of you as our former chief executive of the BRCC, Simona Mushat of Mercer Marsh Benefits, and also we have Dr. Branimir Raduilov, who is a physician. Now, this afternoon is about telemedicine. This is a particularly important area for everyone now, given the restrictions on travel and also the concerns about going to hospitals where there may or may not be greater risks of infection. We're talking at the moment about what is likely to happen over the winter, and I wonder whether we may actually see less flu and colds because people are wearing masks as a matter of course because of COVID. This may be a benefit. We'll need to see how the winter goes. So if you have questions, you will have seen that there is a chat box where you'll have seen my link there to the website address. If you have questions, please put them in the chat box, and our speakers will go through those at the end of the presentations. As I'm talking to you from Bucharest, Desi, we're really pleased to see you in Sofia. I'd like to say a few words on behalf of the BBBA.
Good afternoon. Thank you, Neil, for the kind introduction. My name is Desi Miteva, and I'm the Executive Director of the British Bulgarian Business Association. As Neil mentioned, we are all part of a global network called British Chambers of Commerce, which helps us to cooperate on a global basis. And I think in the current very complicated economic and medical situation, such cooperation is a must. But it's even more important to cooperate with our neighbors. So we are very happy to support the British Romanian Chamber of Commerce with this important webinar today, and very happy also to have a speaker from Bulgaria in the face of Dr. Branimir Raduilov, who will tell you how the situation is in Bulgaria. I agree that the topic of telehealth is very timely, very important. Actually, we came to this conclusion in our chamber as well, and later this month we will be having a discussion online for forming a digital health committee within our organization. So very much looking in the same direction, and I congratulate you for this event and wish you a successful discussion, and looking forward to hearing from the rest of the speakers. Neil, back to you.
Благодаря много, Desi. Right, in that case, I'll hand over to Charlie as our first speaker, I think.
Well, thank you, Neil, Madalena, for the kind introduction. It's a great pleasure to join you all virtually at this event, kindly hosted by the British Romanian Chamber of Commerce and the British Bulgarian Business Association. I'd also like to mention my co-panelists, Simona Mushat from Marsh and Dr. Branimir Raduilov. It's a pleasure being on the panel with you here this afternoon, so thank you for joining. I'm here today representing Helios Care. Helios Care is the vision of our founder CEO, Philip Choban, who I noticed has signed in this afternoon, so absolutely no pressure there. Thank you, Philip, for attending. Teleos is a leader in providing innovative virtual healthcare solutions to businesses and their employees in Romania. Not only that, they have brought over 25 years of experience into this field from their sister company in the US, EDOC, which has over 3 million customers. Teleos, like many telehealth companies, have grown exponentially since the arrival of COVID this year, and we're now supporting over 70,000 customers in Romania with their virtual healthcare needs, and expect to be at around 150,000 by the end of this year. This growth is not a local phenomenon. Indeed, the growth of telemedicine in 2020 has taken a relatively obscure approach to healthcare in 2019, now what is very much considered mainstream and an integral part of healthcare. So, question, what is telemedicine? Why is it important, and is it here to stay? Telemedicine, virtual health, digital healthcare, mobile healthcare. How many of you have actually heard of any of all of these forms of health services? How many of you, I wonder, think that you have experienced such a service? The reality is most of us have experienced the benefits of some or all of the above, sometimes without necessarily being aware of it. How your medical records are stored today are likely to be using a digital solution, even more so since the introduction of Gdpr. A lot of doctors do consultations with other doctors virtually now to ensure the patient getting an important operation gets the most up-to-date and cutting-edge intervention. Supporting industries such as our partners in the insurance industry use digital solutions to ensure customers receive the best care in the best time at the best place. Clinics and pharmacies now use digital platforms to book appointments and distribute prescription drugs, and more technology is influencing how we receive healthcare services. So, what is telemedicine, and why should I use it? Telemedicine in reality is using all of the above technologies to deliver its services and more. Telemedicine is the provision of healthcare services remotely or virtually. Teleos Care is in fact a fully registered clinic, like Regina Maria, without face-to-face consultations. A virtual clinic delivering patient-centric healthcare solutions. Telemedicine does not pretend to replace emergency situations, which require a physical intervention. So please don't call telemedicine for this. This you need to call in Romania 112. That being said, over 80% of calls can be resolved via a telemedicine consultation and its recommendation. With innovation in AI and virtual technologies, what is possible via telemedicine is only going to grow in the future considerably. In recent years, we have seen a significant growth in the use of telemedicine, as I've just shown you by our growth. In the US, for example, in 2012, it was only at 7% of businesses that were using it, whereas today it is over 80%. Last year, in Romania, only 2% of companies in Romania use telemedicine services, and Teleos was one of the few companies providing this service in Romania. This has grown significantly in 2020, with multiple providers and a surge in user numbers, with our number growing from 1,000 customers in 2019 to over 70,000, as I've already explained. And as I said, this number is likely to double by the end of the year. Benefits to employers include reduced medical costs, greater employee satisfaction, improving employee productivity, and even attracting new talent. The current environment has seen up to 85% of Romanians currently, with the current situation, delaying their visit to the doctor with reasons beside the obvious concerns for COVID, including being too busy, guilty, it costing too much, it takes too long to see a doctor or nurse, something I will go into a little bit later, and thinking that the problem just might go away. Again, guilty. With companies being more and more conscious of their green credentials, they are always looking for projects that can bring their carbon footprint down. This is again a hidden benefit of telemedicine. How does it work? In our case, it's very, very simple. Employee will call our call center, which is staffed by qualified nurses. This is the only call center for telemedicine that is staffed by qualified nurses in Romania. Nurse creates a ticket with the patient contact details, medical history, and a brief description of the current problem. The doctor is then assigned for the requested consultation. Then within 15 to 30 minutes maximum, the doctor reviews the case and calls the patient back, and the counselling begins. The call will last as long as necessary to solve the medical issue, with a diagnosis and treatment at the end. At the end of the counselling, the Telehealth doctors offers specific treatment tailored to the patient's needs, or when the problem cannot be solved by telephone, recommends a more detailed follow-up consultation. And within 48 hours of the consultation, the Telehealth specialist will contact the patient to check his or her health. The specialist will also be available for other questions or concerns. What benefits does this bring employees? Well, it can clearly help catch problems earlier and therefore help prevent them from becoming more serious. Instant and easy access with a 24/7 service. 70% of the office visits can be avoided through a telephone call, thereby saving significant amounts of time and cost. This saves, as I said, on unnecessary office visits. It helps to ensure better and more informed patients. Also, the ability to have second opinions through telemedicine gives individuals the ability and the security to be able to check an opinion via a specialist. Telehealth work with leading specialists in the US, Romanian doctors that are working at some of the top hospitals such as Cleveland Clinic, Mayo Clinic, Johns Hopkins, and many others, in order of providing these opinions to Romanian patients that we are representing. Interpretation of test results virtually is something that is being developed and will certainly be available in the near future. So what are some of the more frequent conditions that telemedicine can resolve? Cold and flu, fever, skin issues, sports injuries, upset stomachs or vomiting, eye conditions, joints and aches and pain. And this means that telemedicine is most useful when dealing with a common health issue. As I said before, it's not necessarily suitable for an emergency intervention where you would need to call 112. When traveling and in need of care, the ability to call a doctor and speak in your own language when you're overseas is something that many of our customers and patients have indicated has been hugely helpful and given a degree of security when somebody is traveling. When considering ER or urgent care for a non-emergency medical issue, it is also useful. When assistance is needed after normal hours, how many of you with small children are woken up at 2 o'clock in the morning and are torn between what to do, taking them to a clinic crowded with people or an emergency room, or not having any other choice? Now you have the ability to call a doctor and consult with a pediatrician at 2, 3 o'clock in the morning, and thereby potentially resolve the issue without having to visit a clinic at that early hour in the morning. If a family doctor is not available, which is often, I only heard the other day someone saying that they didn't feel comfortable calling their family doctor after the working hours. So what do you do in that situation other than go to an emergency room or to a 24-hour clinic? This prevents that having to happen. So what are some of the big drivers of this important service? Waiting times. I know this component I'm about to talk about is as pleasant as it sounds. A survey that I read the other day from Software Advice that involved over 5,000 patients found that 97% of respondents were frustrated by waiting times at the doctor's office. Another report showed that 30% of surveyed patients have already walked out of an appointment because of a long wait, and 20% have changed doctors due to waiting time. Moreover, waiting times have further economic repercussions. At a recent study by a major institute in the US in a 2019 report found that long wait times and travel times combined led to some $89 billion annually in missed opportunities. Another analysis by an economist at the University of South Carolina found that a 10-minute increase in emergency room ER wait time for patients with serious conditions will increase the hospital's cost to care for a patient by an average of 6%. That cost is passed on to you, the patient. The author further noted that such critical patients are currently waiting nearly an hour, and this was before COVID. So waiting times is a growing issue with the pressures placed on the healthcare systems around the world. This is only something that is set to get worse unless we use other technologies that will increase the capacity. And to make waiting times more bearable, you might have noticed hospitals offering reading materials or tablets for internet access. Some researchers have even went as far as to investigate the benefits of aromatherapy, reduce waiting room stress. It didn't make the experience any more tolerable, and these attempts at diverting patients' attentions don't solve the issue itself. Here's a fact that the waiting times are here to stay, as I've already mentioned. So why do we wait to receive healthcare? The simple reason for that is that there is aging populations, and there is a shortfall in physicians. And this is, as I said, only a situation that is going to get more and more dire as we go forward. And with these situations impacting on waiting times, the waiting times that people can expect to have when they go to clinics is only going to grow. So, can digital technologies help? Yes. Can telemedicine help with these? Yes. Like anything, it's an emerging technology. It's a new service, and people are resistant to change. Therefore, it is extremely important that we, as those that are involved in telemedicine, do as much as we can to educate the marketplace of the benefits and where and how it can help resolve a lot of the challenges that people face today. Thank you very much indeed.
Thank you very much, Charlie. Before I introduce our next speaker, just to let people know, I gather we now have on watching us online on Facebook Live, 42 other attendees. So this is a very well attended session. Right, I believe our next speaker will be Simona Mushat from Marsh. Simona, good afternoon.
Good afternoon to everybody. Thank you for your kind introduction. So I'm Simona Mushat. I represent Mercer Marsh Benefits. It's our division which gathers the capacities of our two sister companies, Marsh, which is the risk and insurance service provider, and Mercer, which is an HR consultancy company. About a few words about myself. I have more than 13 years in the employee benefits industry, mainly for corporations. I'm working for Marsh & McLennan companies for more than 5 years already, and before in Berede, in Societe Generale, also for this division of employee benefits. Here in Mercer Marsh Benefits at the regional level, because I'm now representing MMB from a regional position, I am a senior consultant for Central and Southeastern Europe. We place around more than 200 million euros in premiums for life and health insurance. We have more than 2,700 corporate clients around this region, and we insure more than 1 million employees with 180 experts in this field. As our decisions are most of the time data-driven, I will share with you today some of the results of two studies that Mercer conducted this year. One is a global study regarding digitalization in health industry, and the other is regarding well-being and was conducted in our region in the Eastern Europe. So if you allow me, I will start already with the results for the global study, which is called Health on Demand. The results were released in February, and it doesn't include yet the implications and impact of the COVID crisis. Let's say it's what the people thought before this crisis. The study was conducted around the globe, as I said. More than 16,000 employees provided their feedback and 1,300 senior decision makers. So it gathered both the feedback from C-level and HR management on one side, and on the other side, the employees' opinion about health insurance, future of health, digitalization of health. So I extracted the data for one key finding, which is the fact that there is a strong business case for digital health, which very well connects with what Telios is also saying, and Charlie, the previous speaker and co-panelist. So one of the main findings is that indeed, almost all employers believe that an investment in health and well-being will be the same or much higher in priority in the future. So 97% of employers are closely looking on the health and well-being. This is a top priority for everybody, and this is no surprise, I guess. The top 3 objectives of the HR management, and actually even at the C level, it's to attract and retain employees, to improve the employee morale and engagement, and of course to improve the workplace safety. I could say that even after the crisis, these priorities would be stable. I don't think that there will have been many changes in this. Regarding the digitalization, around 62 of employers are likely to invest more in digital health in the next 5 years. So there is already a lot of intention around digitalization, and I think this crisis even would speed up. Maybe what we thought initially that it could be possible in 5 years, after this 6 or 9 months, we think that it's possible even in the horizon of 1 or 2 years. This is what I also seen in my current projects. What we used to do in a year time, now we are trying to do in 2-3 months. So we have much more speed because everything is changing from 1 month to the other. Also, the 60% of employers believe that promoting or sponsoring digital health and well-being solution will have a lot or some impact on the staff energy level. And this energy level, of course, is connected with engagement and satisfactions toward the employer and the intention to stay in the company. This is also a very interesting finding. From the employers also perspective, they still believe that promoting or sponsoring digital health and well-being solutions will of course help the staff retention. So half of them, they still believe this, and it's natural to think that if you have enhanced well-being and health solution, it's better. Whereas for the employee sides, only 22% of them said that they are staying with the employer because of this digital health solution. I think for the employees in its actual before or after the crisis, one of the most important factors is still the remuneration. So, but a fair amount, 22%, would even stay mostly because of this enhanced health solution, digital ones. So as a conclusion, we see that employers really understand the link between investing in health and well-being programs and employee attraction, retention, morale, and engagement. So for sure there is a link, and the employers see it. Still, for the employees, they are not yet at that level of knowledgement about these new solutions, and it's not yet very clear for them, or not so many of them would stay in a company for this level of benefits. And it's of course advisable for the employers to engage their employees and to be more transparent and communicate more on the benefits that they are offering, and to make more clearer links between the well-being and the culture of the company and the values, and on how these features could help their lifestyle to be improved for the employees. So that would be in short regarding our global survey. Now I would quickly go towards our more localized regional survey regarding the well-being practices. So we've conducted this survey in May, and it also includes the impact of the COVID-19 crisis. We asked several companies across the region, mainly from Czech, Hungary, Poland, Romania, Bulgaria, Slovakia, and Turkey. And we have replies from senior HR and compensation and benefits experts in the regions. All of them, they had regional positions also, so they were not based only in one country. They provided their view on the regional, let's say, policy or structure. Our key findings were that physical well-being, meaning health and medical side, and work-life balance programs are the most prevalent benefits amongst the companies surveyed. Health and medical plans are typically insured, provided through insurances and not through other channels. Those non-insured prevail in some markets where social security support, such as provision of public health insurance, leaves limited room for insured benefits. 58% of employers believe that their medical plans drive their employee engagement and satisfaction. This is quite similar with the global opinion. And the well-being plan this year, at least, were more focused on the emotional and social well-being, together with the medical and health plan, are considered the most successful benefits provided by the employers. Stress management and psychosocial assistance are the most common new benefits that the employers started to introduce as a response to the crisis. Only 7% of the employers seek additional insurance coverage for the COVID outbreak. And in the midterm, 1 to 3 years, an overwhelming majority of employers see a strong need for stress management, employee assistance programs, and additional products for mental health. So I don't know if this surprises you, but I can say that even in our portfolio of clients, we had many requests in this area to provide more support for the mental well-being. And I will show you only a few insights. So the majority said that they are focusing on the work-life balancing, physical well-being, and on the third one is a mental well-being. The least, let's say, priority was related to the financial side. It was not overlooked, but it was not also the priority for this year. As I said, most of the health and medical plans are insured. 21% subscription, 72% medical insurances, and 7% only self-funded. And regarding the level of the employee satisfaction regarding to their health plan is, let's say, rather medium. So there is a lot to work on the services level of the clinics and of the providers involved in this health market. When we asked them what were the most successful regional well-being programs that drive employee engagement, majority said that well-being plan. This enhanced mental support, some they even implemented EAP during this year. Then it's of course some supplementary health insurance plan, and in some cases this supplementary health plan included telemedicine. And in a third or fourth place, it's the flexible benefits or some other type of benefits. What they plan to introduce as new benefit, I'm repeating myself, but it's still around this mental support, stress management offering, then psychosocial support services, then employee assistance program, telemedicine, and COVID insurance, only 7%. And what they would like to introduce in the midterm, 1 to 3 years, it's again this mental well-being support. Everybody is thinking to enhance this part of the benefits when they are assessing the overall offering towards their employees. This seems to be the one which have more gaps. So this is mostly what we have as insights from Mercer Marsh benefits. If you have any additional questions or comments, please do not hesitate to ask me, and I'm happy to provide you with more details about these studies or our activity in general. Thank you very much.
Thank you very much indeed, Simona. And we'll take questions at the end, I think. So can I now introduce Branimir? You are in Sofia, Branimir, I believe.
Yes, I'm in Sofia, and thank you very much for the opportunity to present you the telehealth in Bulgaria. Just a quick overview of what's happening here. End of 2018, we started Bulgarian digital cluster. We have a lot of telemedicine and other digital health companies that establish it. We use a lot of the reason to do this, just to try to go further with the electronic medical electronic health records and etc. Regarding digital health, we have several providers of this. At the moment, there are 7 in Bulgaria. Some of them are even on Romanian market. Anyway, it was very challenging here, and telehealth started growing dramatically in all specters. My organization is a medical organization. I'm leading a medical organization that is providing services for more than 200,000 patients around Bulgaria in 3 cities. In order to provide those services, we need to use telemedicine, and we decided to use a platform called Consentum. This is a cloud-based platform. One of the interesting thing there is telemedicine. The telemedicine is doctor to doctor, doctor to patient. We heard about this from Charles. I'll not repeat this part. On top of it, Consentum makes an appointment management. It's a CRM. There is e-prescription, electronic patient electronic health record, patient diaries, and etc. etc. There is a mobile app for patients and for doctors. There is integrated medical call center that I'll explain how it can help us during the COVID situation. Of course, one of the things that is give us a better position. The data there, it's according to international standard, which is HL7 FHIR standard that is this platform is using. We are very happy that there is a lot of apps that help us to use from many sources medical information. I would like to share with you what happened in the last 1 year, just as numbers. There are a few slides, but I'll explain just several things. We have more than 600 consultations monthly. Yeah, okay. Thank you very much. As you can see, we have some numbers here just to know from those patients that we are serving, how much of them are using the services. The number is not big, but it's growing. During the months between March, April, and till end of May, the numbers grows. On this slide, you can see the total number for those 12 months is 7,500. The number of doctors consultations per doctor, it's 9. We have at the moment 73 doctors that gives consultations. Next slide, you can see that I would like to give you an idea that there is a duty doctor for 24/7 for kids and for adults. This is the duty doctor consultation. We have individual consultations. Part of them are for medical doctors in different specialty, pediatrics, dermatology, part of surgery, obstetrics, and etc., etc. Part of those are certified in England and United States. Most of them are English speaking, because in our organization we have a lot of English speaking foreigners. In the platform, we have 3 types of consultations that can be provided. This is a phone consultation, written consultation, and video. For Bulgaria, we are not using very often video consultation. This is mainly for outside Bulgaria and in the virtual clinic. We were surprised that people prefer to write down their consultation. We hear what are the occasions people are using consultation. This is the reason I will not go again on this. Can I have the next slide? This is the main thing that I would like to show you. The major number of consultation are in people, the kids below 18. The elderly, it's just 11% of those consultations. Because of this, there is no big difference between consultation between male and female, because this is mainly kids. During the COVID situation, a lot of parents has been very stressed without have possibility going to doctor and etc. and etc. On the next slide, several plans and their prepaid consultation, which is 95% on demand, just 15% are paid. The main very important things is that 93% of people are giving maximum scoring rate. We are trying to have a response rate less than 16 minutes. That means when the 60 minutes, the range is between immediate response till 15, but still we are trying to do this better, having in mind that we have 24/7 services in for our patients. During the night we can have some delays and etc. because the main part is to have people treated in the clinic offline. From the those were the numbers that I would like to show you. During the COVID situation, because the platform has their own call center integrated inside, we managed to have medical triage before people are coming to the clinics, not only for the dose that we use, because we serve several hospitals, other clinics, and etc. in order to be sure that those patients are not with COVID, or if we have symptoms on this, to treat them or give them an advice, if possible, at home. This is just quick overview of what we have here in Bulgaria and what we are using. We expect in the following months and years this to increase dramatically, the usage to increase dramatically, go to more than 30% of the telemedicine up. And we'll see how the things will go during the winter period. Thank you for the attention. That was my minute.
Thank you very much indeed, Matt. I think from my point of view, it really doesn't make much difference which side of the Danube you're on and how useful telemedicine can be. Similarly, which side of the English Channel you're on either. So we have a number of questions you'll be seeing in the chat box. There are questions appearing there. I'm very pleased to see we have 72 viewers on Facebook. So I think we've lost a couple from here, but we're a very well attended webinar overall. So congratulations to our speakers for having such attention in this. I think we should first go through the questions in the chat box. I think the first one is from Ray Davies. I think you're in Bournemouth, Ray? Yep, indeed. So there's a question there from the UK. What barriers to entry to telemedicine are experienced to provide services across the European Union? Does registration of virtual clinics require individual EU member country registrations? Or can a virtual clinic registered in Romania provide services to patients in Bulgaria without further registration requirements, or vice versa, I would imagine? Or can only medical opinions be offered in such circumstances? Who would like to answer that question? As it's mostly medical, Branimir, do you want to deal with that?
Yes, for sure. Regarding regulation in Bulgaria, I just dropped several words there. Still, there is no clear regulation regarding this. Of course, medical service is very regulated, and we should be very, very strict, having in mind and insurance coverage and etc. But if you have a consensus with, if you have a consent from the patient, you can treat everybody all over the world. In Bulgaria, in order to be on the safe side, we have on top of offline clinics that patient used to go, we have those virtual clinics. In certain cases, we need to refer those patients back to be seen by doctor. There is a very strict algorithm for prescription, for giving advice, etc., etc. I hope this answered the questions.
It occurs to me that GDPR must be a relevant issue here, where patient data is being passed across borders.
First of all, it's the GDPR here. It's applies, of course, also all over Europe. But if you have a consent of for sharing medical information, there is no issue, even going outside the European Union.
Right. So even in the UK, it shouldn't be a problem after the end of this year.
Yes, having in mind Brexit. Yes. Right.
Good. We get that point in somewhere in this discussion, as we do in all of these. Right, Simona or Charlie, do you want to add anything to that?
I would say that, thank you, Branimir. From Romanian, what I know is that there are a number of emergency ordinances in regards to telehealth and telemedicine that came in during the COVID period, and that they are in place during the period where there is the emergency in place. I would also say that to deliver medical services, we have registered ourselves, as I mentioned, as a full clinic. That means going through all of the requirements that you would need if you were setting up a hospital in Romania, and there are stringent, checks and balances in regards to that. That's the second point. I don't believe that there is a uniform pan-EU framework for telemedicine. However, it does fall under the digital agreements that were put in place, and also GDPR, which is a European-wide legislation. What I can say is that we have started in Romania an association where we're bringing together players in the telemedicine industry and partners, insurance companies, banks, in order to work closely with the Romanian government to build a legal framework which for digital healthcare, which we believe is something that needs to be in place beyond the current COVID situation, and that currently is only there on a temporary basis, which is a little bit concerning, as a lot of the motives for using telemedicine are not necessarily going to go away just when COVID goes away.
Thank you.
I can add only the fact that I know that the Romanian government is thinking of framework legislation for these telemedicine services, and that the former health ministry started some work on it. Now they switch their focus and attention on the current crisis, of course, but we expect to see some requirements, let's say, a framework of law or methodology for the telemedicine services. In the meantime, they are added to the clinics, or they are provided by some providers as opinions and not connected with the full responsibility of a clinic or a physician's opinion.
Thank you. Liliana Dinescu makes a very good point that also telemedicine works for medical health, for mental health. And I imagine that's a particular importance with anxiety caused by the lockdown and by the current situation in the world, let's call it that. Now, going on through the questions we've been asked here, Branimir, you mentioned in the chat that you're in a green zone.
Which is a gray one, sorry. Yes.
It's a
gray.
Yes. Gray zone. Okay,
yes.
Got it.
Sorry, it's a typo. But still, it's a big green field that we need to see the opportunities that are there.
Okay, good.
And I see here a question regarding the disadvantages of any. So I think Charles already said, in case you have an emergency, you cannot call the teledoctor. So for that, you need to go. So here, of course, it doesn't cover all specialties and all cases, but it helps a lot on the normal and the things which can be scheduled, let's say, and that you can foresee in the future. That should be the downsides, let's say, that I see at the moment.
I mean, there are limitations in regards to what can and can't be done from a virtual healthcare. The need to be physically present for certain interventions that you cannot deliver through virtual healthcare. There are certainly limitations to it. I think also one of the things at the moment, and I think Colin makes a point about how do we ensure consistency. I think besides the fact that there are regulations around what you can and can't do, Colin, it's a good question. I think that one of the greatest challenges that customers have is that there are so many different approaches to telemedicine by different organizations where, you know, some organizations you can wait 2 weeks to have an appointment virtually, others you can get it very quickly. Some provide specialities, some provide services via video, some provide via telephone, some provide both, some are online. So sorting through different types of services and picking the one that fits most is perhaps as much a challenge as anything else. Although, you know, we're constantly in contact with the different players in the marketplace through the association, and we are aware that at the end of the day, the quality is going to be judged by the customer, and these are paid services. And if you're not at the moment delivering quality, then you're not going to be in the marketplace for very long.
Thank you.
Can I take the floor for a second?
Yes.
Thank you for all the comments that are here. I absolutely agree on all of them, especially on the emergency cases. One of the reasons that we have doctor consultation, because when you have doctor at place or other medical personnel, you can have more clear idea what is the situation and to have more precise decision taking, even from the the best for the patient. There is a lot of the disadvantages. One of them for telemedicine. What mean? People don't know what exactly is the regulation there. There is some people are thinking, okay, it's the equal for the patient exam at the doctor. This is the reason we expect in the following years, if a lot of people are using those services, a lot of regulations to come. And this will become, again, disadvantage for all of us, because part of things that we are thinking will be best for the patient will be cut by regulation in order to be more safer. Just those were my comments on this. Thank you.
I think that leads in on the comments on what is best for the patient to a question from our Vice Chairman in Romania, Colin Lovering, which is, what preventive measures are needed to prevent the rush of smaller, less credible organizations setting up lower quality services in telemedicine for purely commercial reasons, and therefore endangering the reputation, trust, and confidence in this valuable resource? Branimir, do you want to come back on that? Because you're obviously the medical professional here.
Yes, exactly. Because the medical service should be timely and quality. Those two things are very important. This is medical service. We have three things on place: price, time, and quality. Of course, when there are a lot of small specialties, you cannot guarantee what will happen. Most probably, there'll be a certification process in Bulgaria very soon to be sure that those people will know exactly what to do and when. Generally, if we have a comment, you cannot prescribe antibiotic to person. It could be yes or no. For example, if you have antibiogram, you can prescribe antibiotic because you know what is. This can be a follow-up visit. We will see a lot of different cases, but at the moment, telehealth can solve more than 80% of general cases that we have in general practice. Mainly used as second opinion, mainly used as full treatment, psychology at home, and etc. Group treatments. There are a lot of things people are trying. Yes.
I can say that I used it a lot for pediatric and pediatrician services. Yes. I think a lot of parents, let's not say mom, would avoid going to the child, to the doctor, but they really need to have an expert opinion, because you don't know when the child is small and you think it has something, you need to find it, and quickly, not to wait 2 days, 3 days, or to stay and wait in the waiting rooms or whatever. So I can testify that it's really highly appreciated. So to speak also about the high advantages, not only disadvantages
of course,
of telemedicine services.
Simona, obviously, if you're doing this on insurance, there's the question who pays for the service, and is there a role there for the insurer, the people who pay for the service, to ensure that the quality is there?
Usually the carriers are embedding this service inside their health insurance products. And it depends on the carrier brand, reputation, and care of quality of services to make sure that they make the right partnerships. We are representing the client in relationship with the carriers, with insurers. And we always do this due diligence in checking the partnerships and vetting based on our knowledge across Europe or from other colleagues in the regions, if they had experience with a particular provider, what is the feedback and so on. And we are providing these recommendations and feedbacks to our clients. So these are interconnected, of course, with the quality of the main provider of healthcare. And they should partner with similar companies in order to have this holistic view on the health product and healthcare for the employees.
Thank you, Simona. We've lost
Neil?
a couple of people, if I may just say, on Zoom, but we're now up to 106 people on Facebook Live.
Unfortunately, I have to leave because I have another call, and this one was a bit in a short notice, so I couldn't postpone that one. But it was a pleasure to talk to you, to meet you, and I hope we will have the chance to catch up in the future also for interesting topics such this one.
We'll take a couple more calls before we finish.
Neil, could I just introduce Philip Coman, who certainly would like, he's the president of the association and might be able to talk a little bit more about that. He's also mentioned that we have been... Pardon?
There's a question from Carmen Onel in the chat box about the name of the association in Romania.
Yes, Philip can perhaps answer that. He's also mentioned that we are, we have been certified, and as I understand it, we're one of the only ones that have been. It answers also Colin's question around knowing how to decide, in regards to quality of services and approaches in the telemedicine industry.
Yeah, I think we can go for a few more minutes. So, indeed, Philip, do you want to unmute yourself and say something about that?
Hello. Okay. First of all, Simona, if you're still there, hello. And Simona was my first contact at Marsh, actually many years ago. Okay. So if she's still here, hello. If not, we'll catch up at some point in time. Okay. I wanted to say hello. There's an Association of Telemedicine in Romania, okay, Asociația Telemedicine Romania. It exists now. It's been formed. It's consisting of ourselves and 3 other players right now. There's going to be 4 insurance companies. There is legislation in front of the government right now actually we're working with some MPs on and some others. I can't go beyond that point because it's not fair to right now. All right, we are bringing members into the association. We've raised a good number of euro right now to help this. So that's brand new. We have one of the top law firms and PR firms in Romania representing us. Lavica Fata is the gentleman's name. He has many years experience, so we're very pleased on this part. Teleos is the forerunner within the group. Okay, I am the president of the association also. Now that kind of came by default, unfortunately. Wasn't planning on that, Neil, but it happened. Okay, something I wasn't asking for. Also, there's a credentialing arm now that has come through from the States and is coming through the World Health Organization also right now. Okay, it's part of the American Telemedicine Association. It's the credentialing arm for telemedicine and doctors within the States. It's doing some of this work in Western Europe, and we are the first company in Eastern Europe that will be actually credentialed and certified as far as our telemedicine platform and our doctors.
Good. Congratulations on the very Romanian Association. Organization in Bulgaria.
This is regarding the digital health. We have a Bulgarian digital health cluster. At the moment, we are working very closely with Bulgarian Medical Association in order to start serving the telemedicine services. because this should be certified in order to be sure that is in front of you is a certified doctor. So a lot of things can happen, and to see how we'll to patients that properly. A lot will come soon, but we'll see. Bulgaria is still on the road of digital healthcare, and we hope that soon a lot of new things will be done there.
Good,
Hi,
thank
Neil.
you.
Neil, Philip
Yes,
again. If
Philip.
I can inject on this with the credentialing right now, that has also been put in front of the EU at this point in time. It's in Brussels right now, and if the credentialing gets approved by Brussels, everybody within the EU will have to fall under this eventually, not for some years, of course, because we know how all this works. But if it does, then Bulgaria, Romania, Hungary, any country that wants to be practicing telemedicine will have to fall under one set of credentialing rules, not only for the telemedicine, but all the physicians practicing also.
Okay, thank you.
Speaking about European Union, we still waiting for standard for exchanging medical information. Of course, European Union could give us standards, and it would be very nice to have them. But still, local legislation is it's the main thing that is changing. We'll see how long it will take the whole European Union to have standards, and we hope that those will come soon.
In your lifetime or mine?
Okay, gentlemen, I think we are going to need to call a close as we are running quite over time. It's been, I think, very well attended, particularly on Facebook. If you're on Facebook, thank you very much indeed. If you'd like to give a like to what you've seen, we'll be delighted. It's good feedback for us to see how people are responding. If you've other questions, I'm sure that any of our speakers will be happy to take questions offline. Now, in each case, the BBBA and the BRCC will have forthcoming online events. And perhaps I can pass it over first to Desi in Sofia to tell us about the next BBBA event online.
Thank you very much, Neil. Before I announce that event, I would like to also mention that probably we as organizations can be the platform for sharing best practices between the UK and our countries, because I think we have a lot to learn from UK practices. We didn't hear much about that in today's webinar, but definitely a topic to be continued. In terms of our upcoming events, I'm very happy that we have this cooperation and BRCC members can attend events that we organize online, as well as vice versa. We are very much focusing on the nearshoring topic in the past months, and our next event is going to be on the 24th of September, when we will be looking to promote Bulgaria and the region as a great nearshoring destination for UK companies. I will be sharing the information with you, Madalina and Anna, and we will be very grateful if you share it with your members who are more than welcome to join. And as I mentioned earlier, we are about to form a digital healthcare committee, which will work closely with the digital healthcare cluster that Branimir mentioned earlier about. So definitely a topic to be continued as well. Thank you again.
Thank you, Desi. And when is the nearshoring event, BBBA?
It's on the 24th of September.
And at what time is that, please?
It's at 9 o'clock British time, 11 o'clock
Right.
Bulgarian.
So not too brutal if you're in the UK.
Yeah, true.
Good. Thank you very much indeed. Kismet with that.
Thank
Anna,
you.
how are we for our next online event with the BRCC?
Thank you, Neil. Thanks everyone for attending this webinar. Thank you, Desislava. We're going to announce our members to participate in your online events as well. And yes, we are having another virtual event next week on a morning session on Tuesday, together with our members, WECO Travel, where we'll discuss the latest updates on tourism and on travel, just to know if we are ready to travel again or not. Besides that, we're going to have 2 offline events. One at RSM venue on Thursday afternoon, and the other on Friday at Izvorde Golf, where we're going to have a golf and family event. I will also share with you our website where you can see all of our events and sign up.
You know, I believe both of us are having golf and family events quite soon. So it obviously seems to be a very good idea, both in Bucharest and in Sofia.
Actually, ours was this past Sunday, and we had more than 200 attendees. So it seems that golf is a good event to be done during COVID crisis, because it's in the open. There is enough space for people to communicate without being crowded. So good luck with yours.
Thank you.
Right. Well, thank you very much to our speakers, and I'm very pleased we've had this cooperation between the 2 chambers here. Should be music to the ears of our friends at the BCC in the UK. So many of our interests are the same, whatever side of the Danube we happen to find ourselves on. So can I all wish you all the very best of health in continuation. I hope that even if you have telemedicine, it's a tool for prevention rather than cure. So I wish you all a very good afternoon. Dobar večer, o dupa masa buna, and I hope to see you at the next chamber events, either in Sofia or in Bucharest. Thank you very much indeed.